So what problems are there associated with exiting? You can have bleeding at the end of the procedure, and if you have some bleeding at the end of the case, you apply local compression to the nephrostomy site. So you just apply pressure for a while. In the early days of percutaneous surgery, I had the CBS television crew came to watch me do percutaneous puncture. And I said, at the end of the procedure, they saw some blood coming out of the nephrostomy tube. I said, you apply pressure for 1 minute, and then the bleeding all stops. So I applied pressure for 1 minute, and I took the sponge away, and it was bleeding again. So I said, can we repeat that again and do another take with the television? And I said, when you apply pressure for 2 minutes, you get no further bleeding. Well, we did it for 5 minutes in the end, but then the bleeding stopped. But you can usually it stops, the bleeding stops. Very occasionally, you may have to use a tamponade balloon that was mentioned earlier. And once in a blue moon, the bleeding doesn't stop. And if the bleeding doesn't stop, you may have to take the patient to interventional radiology and do an immediate occlusion of the artery that's causing the bleeding. So control of hemorrhage postoperatively, we've found that delayed hemorrhage, if it occurs 2 or more days postoperatively, there isn't much bleeding initially, but then it starts bleeding, or if the bleeding persists for more than about 2 days, that would be an indication for us to do an angiogram. And then if you do an angiogram, you do super-selective embolization. And here you can see an example of super-selective embolization. There you see extravasation on the one side, and this is a patient who had 2 perks, and they will end up bleeding from both, but you can put coils into the vessels and occlude it completely, and here you see that it occluded. Here's another example of one coil in when there was a bleeding postoperatively. So in our experience with a review of 4,700 cases that we did, the embolization rate was 1.3%. And if you look at those cases, 50% of them were pseudoaneurysm, 30% were AV fistulas, and there were other causes. Now, because you have bleeding, one of the concepts was, what about putting in an occlusion balloon in the renal artery at the time? So we have people who belong to Jehovah's Witness. I don't know if you have them here. Jehovah's Witness, those people that have that religion do not allow any blood transfusion. So we thought the one way to stop all bleeding would be to put a balloon catheter in the renal artery to control bleeding. So what you do is this. The patient comes to the operating room, and you take an access sheath, and you put it into the femoral artery, okay? And then when the patient's in that position, you can have, once you've got the access sheath in, you can put other catheters in. So you then turn the patient prone, and you advance. When the patient's in the prone position, you can advance the catheter into the renal artery. And when you've got it in the renal artery, you can inflate the balloon in the renal artery and perfuse the kidney with cold saline. So here you see, hopefully, I'm sorry, you can inflate the balloon, and then you can do a percutaneous puncture, and then there's absolutely no blood in the nephrostomy tract. There's nothing. You have perfect control. So we did this with cases with transitional cell carcinoma of the collecting system. And then we did it with some stone patients. and then at the end of the case, you deflate the balloon, inject contrast, and if there was any area that's bleeding, any artery that was bleeding, you can then embolize it straight away. It's a wonderful idea, except it doesn't work. And why doesn't it work? Is because what happens is that the artery often goes into spasm. And out of the first 7 cases that we did, there were the 2 patients we had that had bleeding post-operatively, and we had to embolize them subsequently. So when you have them on the table, first of all, the C-arm is not as good with the angiography to get definition, clear definition, and secondly is the vessels often go into spasm, so we stopped that technique just by the by. So I found that the only absolute technique to prevent hemorrhage after percutaneous renal surgery is not to operate. Thank you very much.